Jamaica's public hospitals will not accept patients for anything except emergencies as the country is roiled by an intense wave of COVID-19 driven by the highly transmissible Omicron variant. Like in other jurisdictions, healthcare workers in Jamaica are themselves falling sick with Omicron, and rates of absenteeism due to illness are putting incredible strain on the ability of those who remain to deliver an adequate level of service to patients. The Jamaica Gleaner spoke to the senior medical officer of the Maypen Hospital, Dr. Bradley Edwards, who said that 12% of the facility's healthcare workers are either in quarantine or isolation. Edwards said that even the promise of lucrative overtime hours weren't enough to entice burnt-out staffers to take on extra shifts. It's just too much stress, the hospital official told the news outlet. The Gleaner reports that the University Hospital of the West Indies in St. Andrew is operating with about 6% of its staff unable to work due to isolation or quarantine. What this means is that, for now, only cases deemed emergencies will be admitted to hospitals across Jamaica. Patients awaiting elective surgery, which can cover anything from kidney stone removal to hip replacements and mastectomies, will have to wait until what Dr. Edwards calls devastation at the nation's hospitals recedes. The Gleaner reports that the rate of deaths during this Omicron wave is far less than Jamaica's crisis point last August, but the vast number of patients infected by this highly transmissible variant is driving high hospitalization numbers. Additionally, January is reportedly a month where people with lifestyle diseases such as diabetes and hypertension experience a flare-up of symptoms after the December holiday season. Despite the current hospital crisis and an overall positivity rate of over 60% for COVID-19 tests, Prime Minister Andrew Holness says the government is not prepared to tighten up movement or gathering restrictions in response. With only 21% of the population fully vaccinated, this means that the country must buckle down and brace for Omicron's full impact.